Okay. John, it's all yours. Unmute yourself, John. You're muted. John, you're muted. John, you're unmuted. Are you all right?
Okay, now we're ready to go.
Okay.
Okay, so we're going to just briefly review a very few things that we've gone through in the last 3 weeks. The reason we're doing this is because there's some folks on our Zoom meeting this evening who have not been on before. So we're going to touch very, very lightly on the last 3 hours, really, that we've spent on microcurrent therapy. And then we're going to go and look at some other applications as to why you should be using microcurrent therapy, whether you have the clinic in a case or whether you have the clinic in the pocket. And we're very concerned because sometimes people wind up with a milliamperage device and they feel the stinging of it and they say, well, it's doing a lot more than the microcurrent because I can't feel the microcurrent. But that's not true, just the opposite is true. So why do we need microcurrent? And the answer is it's a body balancing system that can help the body to be the best it can be.
John, can I interrupt you for a minute? You're for some reason, your PowerPoint is not enlarged. It's
all right. What have we got?
I think you need to bring it. You should be.
I'm going to stop this and go back then. I'm not sure what's going on here, Michael.
Can you tell too? Can you see it?
No, I can see it.
Yeah.
It's is it too small on the screen?
Yeah,
Okay, just a moment.
PowerPoint is literally in a small square, and you're in your full view of you, but yeah.
How about now?
Perfect. Got it.
Okay. So we see it's a body balancing system that can help the body be the best you can be. And this is for everyone, no matter what age group really that you're in. Whether you're younger, whether you're older, whether you're kicking your heels up in your youth and middle age. So the point is you can feel better, you can have more energy, you can control and get rid of the pain. And pain is a relatively easy thing to get rid of if you do not have some type of blockage in your body. And we need to remember this, that by the time you have pain, unless you fall down the steps or injure yourself, hitting yourself with a hammer or bumping into a door, pain is a result of you not paying attention to some of the problems that maybe we've ignored. So it's the last resort, so to speak. So we ask the question, if there was a way to bring your immune system to the best it can be using less vitamins and drugs, would you be interested? Most people will say yes. And if there was a way to look better even, feel better, live longer, would you be interested? If there was a state-of-the-art health system that could help you and your family. Oh, thank you. We knew you'd be interested in that. So if this could save you money because you feel much better and you wouldn't have to spend that much money on drugs, prescription drugs, or doctor visit, would you be interested? And what if you could boost your immune system in about the same time it takes just to sign in at the receptionist window. And we've covered that in some of our previous Zoom meetings here in the last 3 weeks. Remember that the effect of the treatment is like a tidal wave. It's very, very powerful, but the treatment itself is gentle, soothing, and relaxing. And people are not used to that. When they go to a physical therapist or a hospital, a chiropractor's office, an acupuncturist, and they will often feel a stinging and they'll say, oh yes, it's working. Well, we've covered that also, but when you're feeling it, the more you feel it, it may be blocking the pain, which is its main purpose, but you're not necessarily healing your body. You could actually be slowing the healing and reparative process of your body. We've got all kind of research on that. And we're talking about the clinic in a case. Many of you have that. Some of you have the clinic in the pocket. There are some of these instruments that's out, been there for a good many years. So almost anyone in the health field can use this. And especially for home health care, you literally have a treasure trove. So we might say, well, what happens here when we give ourselves a treatment, when we get a treatment? You have pain control, cell renewal, it boosts the immune system, body detox, membrane transport, core energy. You don't have to wait for a day for vitamins to give you energy. It's even faster than a cup of coffee. Anti-aging, we have yet to cover that. If we do, you can ease a line or wrinkle around your eyes in literally a minute. And if you do this on a regular basis, you'll notice a permanence to it. Now, all of these things that you see on the screen, it looks like a sales hype. I'm not selling anything. I used to. I don't have to do what I'm doing right now. I want you to help yourself. And just to remind you that all of these things happen in just a few minutes. And who does not really need that in their health? So it's not just claims trying to sell an instrument. We have a lot of peer-reviewed research that we're going to show a little bit of that, and we've got plenty more should you require it. We can make it available in printed form, or we can email it to you. We're hopefully reaching people to where they don't set these systems aside. And because I've asked some of you, when's the last time you used your instrument? That is, if you have one. Or when's the last time you've been to Dr. Epitropoulos and gotten the microcurrent treatment? And they'll say, well, you know, it's been a while. Why? And a point is if you wait until you hurt to treat yourself, you've waited way too long. And someone will say, well, wait a minute, why should I treat myself when I don't hurt? We're going to show you. Because microcurrent can increase the energy of each cell in your body by as much as 500% above normal. Now, it has nothing to do with pain necessarily. It has to do with the health of your body, how long you're going to live. The growth and repair of the body energy is very, very necessary. Medical doctors used to say, well, you know how all of this happens? You have the body is a chemical electrical system. The chemicals release, and then it starts an electrical connection. The brain is a good example. And you know what? They've changed their view on that. They said, no, no, no. It's electrical change first. That triggers the chemical energy from carbohydrates, fats, and others. That's the thing that is energizing each cell, which is the ATP. And this is one that we've shown last week too. It can increase the absorption of the vitamins in your body by 30 to 40%. Hippocrates said, let food be thy medicine and let medicine be thy food. A lot of truth to that. That's really the best place to get your nutrients, your vitamins, your minerals, your amino acids. So all of that is very, very important. And to a point, the medical doctors who are not that much into nutritional supplements like vitamins, minerals, herbs, homeopathics, they say, well, yeah, you're just, your body's not absorbing it. You have very, very expensive urine. And you know what? For the most part, that's true for people because of the malabsorption blockages in the body. Now, when this says that it helps you to absorb your vitamins as much as 30 to 40% above what you normally would, isn't that something that we need? You see how, go ahead, take your vitamins, your herbs, and so on. But this will help you maximize their effect. Now, we will give a word of caution here. If you're on a prescription drug, it will also increase the absorption of the effects of that drug that was given to you by the medical doctor. So we suggest that you wait at least 2 hours before or 2 hours afterwards in using microcurrent, just in case, not that microcurrent is going to help you, just in case some of the side effects of the drugs will be more than what you need. The research shows that it can speed healing in your body as much as 73% faster. We've shown some of the hospitals, some of the research associations that shows that this is an actuality. I've seen it myself to where people, when they break a bone, an ankle or a wrist, instead of taking 6 to 8 weeks to heal, they do it in 2.5 weeks, literally. So this is not hype. I have nothing to gain by this. I'm just trying to help you to understand why you should be using it. This will increase insulin binding in your body. Now, who is it that has to take insulin? Okay, I didn't hear you. I don't want to hear you, but I know what you said. People who have diabetes, type 1, type 2. So here again, it's going to, if you're on insulin, it would be a good thing to separate your microcurrent treatment from the insulin that you take, because it's going to increase the absorption level. And you don't want an over amount of the insulin that you're ingesting in an artificial form. There have been a number of people, quite a few, who've made a dramatic change by treating their pancreas and liver, and with their doctor's permission, doing the proper testing, they've gotten themselves off of insulin. Now, that's something for you and your medical doctor to decide. Here again, microcurrent is anti-inflammatory. Inflammation is connected with all kinds of very, very bad problems in the body. And this is a before and after photograph of a slide showing after about 45 minutes of treatment on the back, how microcurrent just literally cooled everything down, normalized the tissue. So it really seems to have the unlimited ability to help almost any health problem. So stop and think for a moment. What is your health problem? Can you name it? Well, I don't want to hear it, but to yourself. You know, a lot of people never really come to that conclusion. They just say, well, I don't feel good today. Well, why don't you feel good? Do you hurt? Where do you hurt? Why do you hurt? Does it have a connection to something else? All the muscles in the body connect to the spinal cord. They connect to organs in the body. They connect to neurovascular reflexes. They connect to the brain. And they connect to the teeth, which may be another seminar we'll have in that regard. So you can modulate this. You can help normalize. You can help steer the body toward being the best it can possibly be by using microcurrent. Did you know your body can rebuild itself in less than 365 days? And those of you who were on last week, you say, oh yeah, he showed that last week. But again, we have some new people here. DNA. You get new DNA if everything's working right in 2 months. Skin in 1 month. So if your skin problems are not clearing out, you don't have a skin problem, you have a body problem. Something is blocking it. What could that be? Liver in 6 weeks, stomach lining in 5 days. So do you really have to be on a stomach medication for months and years? If you do, then all the medication is doing is putting out the fire alarm of an ulcer. It's not necessarily curing it. Again, bones in 3 months, a new skeleton if everything's working right. Blood, new blood in 4 months. Your brain rebuilds itself in a year. And all of this has to do with biological energy. This comes from a substance, the second most important thing in the body that it has to, and that's adenosine triphosphate, or ATP. It's in every single cell of the body. It's the energy, it's a gasoline tank in every single cell of the body. Now, where do the cells of the body go? Everywhere. So can you see how that's connected in health? And we have people who have doubted this. They said, no, that can't be true, because most of the instruments that's used for pain do not do that. They actually lower that biological energy. Now, you should be, if you're following along, ask this question. You might say, well, I've been using microcurrent, or I've been going to the chiropractor, I've been taking vitamins, I've been taking herbs. So if the body can repair itself, renew itself, then what's preventing it from doing so? Why don't we look at a few things here? We're talking about the weak immune system, an unbalanced immune system. And so one would be more susceptible to infection. You're more likely to get infections more frequently than most people. You ever notice there's some people, they seem to be always sick, and when they're not, they're talking about how they were sick, and that's when you want to go to the other side of the room or find out you have a pseudo phone call that you have to answer. So here's the question. It's a serious one. Why do you have those symptoms that don't go away? What's making our immune system weak? You have infections like bacteria, virus, fungus. Food additives are in everything. Medication, antibiotics, the environment. What do you work with? What chemicals do you have in your home? Junk foods, sugar is in everything. Luxury foods, alcohol, tobacco, coffee, tea. These may be stimulants, and they're not necessarily out of place, but an overabundance, or not even an overabundance, put on top of these other things that we see, like stress and geopathic stress. All of these are subjects in themselves that we could be talking about, but they attack our immune system. They block our ability to be the best we can, and that's what we're talking about. Be the best you can. Well, they're enjoying themselves. He's not feeling any pain. We've got pollution. Remember here a few weeks ago when we saw in China, when they quarantined everybody, they stopped driving the cars. And for the first time in decades, they could see the mountains. Wow. Well, it's not just that kind of pollution that can affect us. There's all kind of particulates and cause nerve damage. You can have bacteria, parasites. That's another subject we could cover in some time, something we need to really look at. Something that people don't really think about is all of these electronic gadgets, including your cell phone, who the cell phone people and manufacturers say there's nothing to that. They don't emanate any low frequencies that are deleterious to your health. But if you have a radio and it's right next to your head, whether it's turned on or not, a clock radio, if it's near the head of your bed, move it away at least a couple of feet. Fax machines. So you're sitting there at your home office, fax machines on your left, the tower or your internet's on your right, your computer's practically in your lap. Electric blankets, I don't think we're using them right now, but microwaves. If you have the smallest leak in a microwave and you're standing even several feet away, it's like a laser shot. You've got other things like toasters. You have TVs. Now, some of these, the industry has realized that, yes, these emanate harmful radiation. If you stand in front of your stove, you're getting some radiation there. And you can stand it. You probably won't notice anything. But it can be a pileup of this, that, and many other things that will bring your resistance down, that will act in time as a blockage. There's power lines going into the building. Where does it come in? Where the meter is? Is it right behind your bed or near it? That's belting out a tremendous amount of bad energy. And over time, it can really affect you very, very seriously. It can block the best of therapies. And it takes a while usually. It's gradual. And according to one of the experts, if you move your bed away from where you are sleeping, and there is this thing on the other side of the wall. So you're going through ceilings, floors, or walls, doesn't matter. It radiates right into it. If you move away to where it's not influencing you, one authority says it will take about 6 weeks for you to get back to normal. So that's a factor in how well things respond as far as remedies are concerned. Other things, you've got these power grids, these power stations, tremendous emanation of voltage under the ground, electric blankets, hair dryers measured at 1 foot, TV, electric range. Well, if you look at that, a hair dryer is 23 times past what the FDA says is safe as far as electrical disturbances to your body. TV, same thing. Now, they've improved that, but you've also got the internet, and that goes all throughout your house. The new meters outside the house, the meter man doesn't come anymore. He can pick it up. How can he pick it up? Because that's broadcasting 24/7. Wow. An electric range measured at 1 foot is 13 times the limit that the FDA, by the time they get involved, they have to make some admissions that yes. What is that? Well, the US government has said that only 3 milligauss can affect your health. And look at here, how long do you stand next to the stove, which is 13 times past that milligauss? Now, wait a minute. Why are we talking about this? Because these are things that are piling up on our body and making us resistant to being the best we can be. So you have to look at that. Nobody can do this for you. Your husband can help you, your wife can help you, but it's you that are responsible for your own health. Do you get it? I've been preaching this for decades. We got other things. All kinds of chemicals found in the home. got solvents, paint, car maintenance, washing dishes. Wow. Washing clothes, swimming pool, mothballs, gasoline, all cleaning fluids. Wow. What about all the new stuff for hand sanitizers that just came out yesterday, I believe it was. And there are 13 hand sanitizers that they say do not use these, and definitely do not let children use these hand sanitizers. You'll have to look that up yourself. It just came out, and it actually names these hand sanitizers. I just wanted to show you some other things that we've collected here. This is Tufts University, and it's doubtful that they've cleared this up because of the industry, that milk from cows given bovine growth hormone may actually trigger cancer in humans. Now, does that mean that if you drink a glass of milk, you're going to have cancer? No. But if you see you're drinking the milk that has this in it, and you've got all these other things piling up on you, and now you get into a painful situation, and you take this medication, this aspirin, this treatment, whatever, oh yeah, the pain went away, you're still cooking on the inside. You can have something removed in your body. If you have a growth in your body and they remove it, all they've done is remove something that your body put in a wastebasket. And that's away from a naturopathic observation. We look at that. When you get a fibroid tumor, when you get a lump, a bump, a tumor, the body says, I don't like this, so I'm going to put it in this one concentrated thing. And people go ballistic because they've got these, and most people do. But when the doctor says, oh, we've discovered this, that, or the other, and you say, cut it out, cut it out. Okay, that may be the thing to do. Dan Clark used to say that if a woman has a lump in her breast, that she needs to have it removed. Not the breast necessarily, but that lump, have a lumpectomy. Don't try to cure it with herbs. It's not going to work. I've seen this through the years too. Herbs can help, vitamins can help, but have the lumpectomy if you can. The other is up to you. But here's the point. Your body didn't change. It just simply put something in the wastebasket and they emptied the wastebasket. So you need to change your lifestyle. And that's what these seminars are about. Okay, let's take a shower, and here we get more good news. Chlorine hardens the arteries. Chloroform, free radicals, carcinogens. DCA causes liver cancer in animals. All kinds of stuff. Chlorinated water. If you're drinking tap water, get any kind of a filter. You could, for $29.95, you can get a Brita filter, and you're going to help yourself with that. Really and truly. And as was brought out, and maybe you looked at this, maybe you haven't, some bottled water is nothing more than tap water, not even necessarily filtered. So you need to look at these things. Again, each one of these things won't kill you. They won't necessarily make you sick, but they could be the straw that broke the camel's back. It wasn't the straw, it was a pileup of everything. Here's some other stuff. What do you put under your arms as a deodorant? Here you've got things that you can't even pronounce. Aluminum chlorohydrate, cyclomethicone, hydrogenated castor oil. Castor oil is a good thing, but hydrogenated means it's cooked into nothing. And then these other things, and you put that under your arm. Well, I don't want to smell. No, and I don't want to be around you if you do smell. But the point being, you see, this is a burden. This is adding to the burden of our body. You look at the hair shampoo. When's the last time you looked at the ingredients of what you're washing your hair with? Key ingredient for automobile engine cleaning. What about brushing your teeth or washing your face? You can't even pronounce half of these words. And yet, what's wrong with soap? What's the best thing you can do with the coronavirus? Wash your hands with what? Soap. Pure soap. And yet, look what we see here as far as facial products are concerned. The same is true with toothpaste. Most of them will have a warning if you swallow. It doesn't say just spit it out. It says call the Poison Control Center. Maybe they've changed it recently. This is a couple years old, but I doubt it. So do you see what we're doing? We're trying to help you to look at your own health, what's piling up inside your body that you cannot see. And now all of a sudden, well, I hurt. I can't digest things. My stomach hurts. I get these headaches. My hip hurts all the time. My muscles hurt. My rump hurts. I got this shoulder pain. I get my big toe. It hurts sometime. I don't know why. I get this funny feeling when I have go to the bathroom. I get this funny. I can't enjoy the marital nuptials because of pain or some other problem. It's not, those are individual names. It's the body that's not doing right. And we've piled up on it. So can drugs cause problems that maybe you really don't have? Certain medicines can weaken your immune system. Now, we're going to look a little bit closer here at doxycycline. You've probably had that because it's an antibiotic, okay? Very safe, they say. I'm not even going to talk about these other things. But let's look at doxycycline. It's an antibiotic, and this has been reviewed by drugs.com just back in December. Here's just some of the side effects that taking it. Now, wait a minute, what are you taking it for? Oh, you may have a bacterial infection. Okay, so we're going to give you doxycycline, and then you get some of these side effects here. Have you ever noticed that? You might say, well, I feel a little nausea when I take that, or I get a headache, or yeah, it seems like I got this little lump in my armpit, or in your neck, or in your groin. Have you ever done that? Do you have a lump in your neck? When you get sick, get a cold, flu, you'll feel around there and you'll feel some little nodules. You get them under the arm, feel it in the groin, a little knob, little nodule. So let's look at this and see if someone can pick out multiple side effects. Now remember, it's just doxycycline, an antibiotic. Let's say that you develop some dizziness and maybe a fast heartbeat. And, you know, probably from time to time, if you get up too quick, you can get dizzy. We're not talking about that. If you see something on television that upsets you, maybe you're looking at some kind of a movie or hear the news, you get a fast heartbeat, tightness in the chest, unusual tiredness or weakness. Well, everyone goes up and down, especially as we have the accumulation of chronology on our human frame called getting older. Let's say now that you have those four things and you haven't had them before. What are you going to do? Yeah, and not dizzy all the time, but sometimes my heart thumps and, real or imagined, tightness in the chest. Now you're thinking yourself into a problem, but it may be real. So you're probably going to run to the doctor and he's going to say, and you're going to complain about these particular things: dizziness, fast heartbeat, tightness in the chest. You know, I'm tired all the time, doc. Okay, he's going to say, okay, let's see. Dizziness, fast heart. You got a heart problem, buddy. Heart medications he's going to give you. He's going to maybe, if those don't work, he's going to give you a pacemaker after more tests. And then we need to put you in a hospital and check you out. 3 days, they're going to go through all these tests. And they're going to say, well, we know you still have those symptoms, but we can't find, all your tests are normal. How many times has that happened to you? And yet you still have your dizziness, fast heartbeat, chest tightness, and weakness. That should make you think, friends. That should make you think. Here's another one. This was a diabetes drug. And this appeared in a very prestigious journal, medical journal, Circulation. And they found that this particular diabetes drug was linked to many heart attacks and heart failure and 217 deaths. Now, here's some of the symptoms that they had. Would you associate those symptoms with a drug for blood sugar? Have you ever asked, if you're on a prescription for anything, if it's a prescription, have you ever asked yourself, could my medicine be causing this? Yeah, I looked it over. It's a long list. The print is small. I didn't have my magnifying glass. If you even did that, which I doubt. Please excuse me. I'm a little cynical because I've seen this thousands of times. Here's another thing here, and we're not picking on diabetes drugs, but this is from the archives of internal medicine. And the Swiss study found that some diabetes drugs double or triple the risk of fractured or broken bones after just 1 year of use. When did they tell you you can get off of diabetic medicine? Just trying to make you think, that's all. Don't get scared, don't get ballistic. Here's the Kaiser Permanente, Northern California, their hospital. And they did a 10-year study on the best-selling diabetes drug, and they found that there was a 40% increased probability of developing cancer. Now, if that doesn't make you think something, I don't know, we can quit right now, I guess. But would you associate those symptoms with symptoms as a drug for blood sugar? What happened to your immune system? See, the point being, read the label. And it's not all on the label. It's on the detailed sheet that comes with your prescription that you probably put in the drawer, don't even know where it's at. You need to read the label. The doctor does not have the time to sit there and read through all of these, and he's not going to terrify you by telling you all the possible side effects. All you have to do is type in the name of your prescription. That's all, just that name, and then add side effects on Google. Boom. Now read it and look at it and think about it. Now, why am I saying this? Why are we doing this? It's because you must examine the side effects and decide, is this the way I want to go? Isn't there something else we can do to boost our body and help us to be the best we can be? Inflammation can damage our immune system. And when that is weakened, we're susceptible to many, many things. So don't end up here because of prescription that you're taking and the side effects. And here again, being a bit redundant, have you ever checked that? Now, you might say, well, I don't know where that sheet is. You know, it's so small and you probably need a magnifying glass. But if you can't, if you don't have it, like we say, go to Google, type it in, or you can go to the pharmacy where you got your prescription and ask him for a printout of the information about that particular drug. Please do that for yourself. Have you even checked? Poor doctors. Pity the poor doctors. I really do. You've got all these people coming in with all of these problems, with all the stuff that we've accumulated throughout our life. Now we're brushing our teeth and putting stuff under our arms and taking that shower and drinking that water. breathing that air and leaning against the stove, and there's a cell phone stuck in our ear. The real one is the bud. Now you got a direct transmission into your brain. You need to look that one up. Anyway, here's some more information on what real microcurrent can do. If you have an instrument, please use it. If you don't, you can get one. I'm not selling them. You can talk to Dr. Mike about that. There's other information you can get, but we're not talking about a TENS unit. We're not talking about this really good looking tabletop unit that looks like a fishing tackle box. Those are milliamperage devices or glorified TENS units. The results are not the same. We're not trashing them. We're just saying they're not doing the same that microcurrent does. See, we're talking about something way beyond just being pain control. Pain control, when you know about it, for the most part, is relatively easy. If you don't get pain control, then the pain is a very, very strong fire alarm. And as we mentioned, putting out the fire alarm does not put out the fire. Microcurrent is a spark of life. We have an entire program on that. It's designed for medical personnel, and it shows how it really triggers progenitor cells, which are the body's own stem cells. The difference is that stem cells will be there. Progenitor cells come to the rescue. Same thing, but when the situation is remedied, they no longer are there. The stem cell will be there whether you need it or not. And it's been linked to lumps and bumps of a carcinogenic nature. And again, we're not trying to scare you. We're just saying, we're looking at the whole panoply of everything here. Here's some information from Johns Hopkins Hospital. And I know the man who had put the microcurrent instrument into Johns Hopkins. And they treated these, they were treating skin ulcers, people with AIDS, adrenal insufficiency, or arterial insufficiency. That's when you get clogged up. If you have something in the neck, the doctor says, well, your vein is, our artery is clogged. We need to go in there and ream it out. Cerebral vascular accident, that can be a stroke, COPD, renal failure. All these people had skin ulcers because of their not being fixed for these problems. And here's the point, 100% of those lesions were healed in a minimum in about 7 weeks. The average time of healing was 48 hours over 16 days. So it wasn't just a few seconds, it was spread over a little over 2 weeks. Surgical debridement, do you know what that is? That means that when you heal, the scarring is now dead tissue. And usually they have to scrape it off, they have to take it off surgically, the dead tissue. And did you see what it says here? It appeared to disappear spontaneously. This is John from Johns Hopkins Hospital, one of the most prestigious. And here's the other neat thing, they didn't come back. How long have you been on your drug? Or maybe a similar problem. Hey, I'm not bashing drugs. If you have to take them, fine. If you have to have surgery, fine. But you have not changed anything with your body. It's the body that does the healing. In the book of Leviticus, it says the life is in the blood. How does microcurrent and your blood work? Well, red blood cells transport hormones, antibiotics, oxygen, nutrients, and waste products to the kidneys. So red blood cells is very, very important. The other thing that's very, very important is blood separation. I was talking to someone just Thursday, and they said, well, yeah, you're having some plaquing in your carotid artery here. And the idea is they can go in to your body with a very long tube and kind of scrape it out. The problem is all that debris has to go somewhere. Has to go somewhere. What if it gets stuck in your brain or in your heart? Anyway, that's a method of getting rid of it, but blood separation is crucial. In other words, we don't want blood to clump together and then stick to the arterial wall. Now, we did a lot of work in England, tremendous amount, when I was involved with instrumentation. And this particular hospital got a hold of a microcurrent instrument. And this roulade shows the blood cells, the red blood cells stacked together just like coins. People see this and they say, oh, I'd like to have that in Las Vegas and have them as coins. Okay, so after the 6th treatment, look what happened. It separated it. They use microcurrent. Free radicals, another microscope. This, by the way, these are pictures of real microscopic pictures here. We didn't just make it up, and it appeared back in 2009 Anti-Aging News. Free radicals, it freed it right up. You've got all kinds of things that cleared up after the 6th treatment. Look at the difference. So forget pain, forget tumors, forget anything. Keep the brain working, keep the blood flowing. The life is in the blood. This goes back a few years when we were working at Total Health Clinic in Ormond Beach, Florida. And we had this guy comes in with prostate cancer, and they took, I think it's called an HLV. They took a blood sample, and he didn't have a whole lot of blood cells for the amount of area that they were looking at in the microscope. After 4 days of an ionic bath, a literal bath with microcurrent in it, that's another subject, don't ask, at this time, and look at the difference. He came in on a Monday, and this was Friday. Wow, what a difference. So we have to ask, well, what about other areas of health? We need to keep calm and make everything in life matter to us. Well, here's another area. People have antidepressants, and you've got if you want to come up with some interesting side effects, go ahead and Google some of these antidepressants, which many people are on. And look at the difference with microcurrent, how effective they are. So if you're on Prozac, you need to look for something else. It's only 10% effective, but it may work for you. But remember, look at the side effects. If you look for side effects for microcurrent therapy using CES, cranial electrical stimulation, look at the difference. Look at the difference, and there's no side effects to that. Okay, so if someone says, well, how about every day? We don't have any of those problems. I feel pretty good. But here's some other research that 327 patients, I think it was Dan Kirsch who came up with this. He has a real microcurrent. And look at the difference. Energy up almost 80%, less tired, right at 80%, more stamina, better sleep, rarely sick, clearer thinking. So this is how it applies to life. If you have no problems, if you're already feeling good, feel the best you can be, okay? And of course the doctor comes in and we have to throw something funny in, don't we? I wanted to show you just some of the testimonials. We're not going to go through all of them, but you can see that which is marked in red. Just about every person that is here, I personally know. and how microcurrent really affected nasal congestion, their bladder at night, a breast tumor. I've shown you that picture of the individual, I believe it was last week or the week before. Stomach tube, neck pain, knee pain, less need for other treatments, chronic neck pain. Homeopathics work better, Alzheimer's, kidney dialysis, prostate problems. Now you got to catch these things earlier. As we mentioned, by the time you have a symptom, you've had the problem for quite a while. Case in point, by the time you have a tumor, you go to the doctor and he says, well, yeah, you have a growth here. The medical community, and it's more than one person, more than one source, they say it started at least 10 to 15 years ago. You ignored it. Maybe you didn't have any symptoms. Pancreatic cancer, same thing, 15 to 20 years before it shows up in normal tests. So now give me a treatment quick. I got to fix it. Not going to happen, friends. You're going to have to be patient. You're going to have to look at the totality of the body. How can you treat the whole body? Very, very easy. And there are multiple ways. Anti-aging treatments. We showed that last week with Dr. Dan in Orlando. Breast lift. We did a seminar, international seminar in Orlando. We had people from Austria and Germany, England, and they were there, and nobody wanted to volunteer for some reason here in the United States for a demonstration. So we got a man in his early to late 30s, and he bared his chest, and after about 5 or 6 minutes, we literally lifted the breast about an inch, a little over an inch. It just raised the muscle, that's all it did. Anyway, I don't do that anymore. Didn't do it. Hip replacement pain. Dr. Peter, treatment with animals, less symptoms. A lot of things here with people who were just about gone and they were back in life. Knee problems, fractured in the wrist, energy out, eye is better, back to life again. Irritable bowel syndrome, fell on the ice. Okay, cyst on the dog's eyes. I think if you're listening there, you know that you. Sinus pain, flying. Report follow-up. This is a follow-up after one who was just remarkably improved before. Achilles tendon, neck pain, sleeping, sinus, asthma, heart, mom's cancer, nerves, prostate, sinus, edema, kidney stones, ankle swelling, T-boned in an accident, urinary tract pain, hips and rabbit legs, not even going into that, memory, anxiety, mental pressure, dog with tendinitis, all kind of things here. Now, as I mentioned, I know almost all these people. They sent me their comments about their instrument and what results they got. No one got any money for their testimonials. They were just that excited. And some of you are listening today who are on these testimonials. While it's microcurrent is safe and effective, how you use it is up to you. When you use it is up to you. If you use it is up to you. If you don't have one, they're available. Don't call me for one. If you are, you can see Dr. Mike, there's a couple phone numbers there at the end. I can answer questions. I'm happy to do that to the extent that it would be mutually convenient. And see Dr. Mike, at the very least, you can go in the office and get a couple of treatments a week for a while and watch how you feel. So here again, we're talking about the clinic of the case, but real microcurrent, and anybody can use it.
Normally have it. That's how you want it.
Okay, so the clinic in a case is not just an instrument, it's been called a complete health system.
Any questions? You want to leave?
By the way,
Okay, I hear somebody talking.
John, thank you so very much. What a tremendous, I mean, every week your presentations just get just more phenomenal each week. I mean, it's many years as I've been listening to you, I hear something that's new every time I listen to you. And that's why I remind everyone, please attend these weekly. I mean, this is in and of itself, getting this kind of information from John himself is a real blessing, and you'll learn things and hear things that you'll hear something new each week. We are recording these, and you can, I'm archiving them. And actually what I'm doing, if you'll notice, when my email blasts go out each week, there will be a recording the previous week. If in fact you missed it or you want to share with someone, certainly please let me know. I'm going to leave the time open for questions. Does anyone out there have a question of John right now before we go on for a few more minutes? And I've unmuted everyone, I think. You all are unmuted. So any questions you have, go ahead.
Hello, it's Juanella Edwards. John, for using the machine when you use it, where do you normally use it to do your whole body every day? To do your whole system every day, under your feet or on your hands?
Both systems work very well.
Okay, that's my question.
Yeah, some just for lack of not wanting to take their shoes off, I guess, do it with hand to hand every day. I personally feel, because of some of the research from Austria that was done a long time ago in a very prestigious medical facility, they use foot to foot. I still do hand to hand from time to time. I treat specifically if I feel I have the need. I try to do foot to foot.
I can't participate, so.
John, this is Lamont. John, this is Lamont. I want to thank you again very much.
Well, it's nice and cool outside. Man.
You had to say something, I think.
Okay, any questions? No questions?
Good.
John?
Was there a question?
Yes, we don't talk over each other.
Are there any questions that you folks have? I will tell, go ahead.